Hi there, welcome back everyone. My name is Trevor and this is Teresa Craig, and she is the owner of a franchise out in East Edmonton and Fort Saskatchewan for Qualicare Home Care.
Hi.
And today we're going to be talking about, before I forget, here's some information on dementia. Dementia, okay? So here's a quote from Laurie Graham. None of us wants to be reminded that dementia is random, relentless, and frighteningly common.
Yeah.
It's true, because I've got some people in my wife's family both suffered from dementia, and it's devastating to watch. We're going to talk a little bit about that today. Here's a quick statistic for you guys from the prevalence of monetary costs of dementia in Canada. Over 500,000 the number of Canadians living with dementia today, and 25,000 the number of Canadians diagnosed with dementia every year, and over $12 billion the annual cost to Canadians for caring for those who live with dementia. So it's quite a big problem, a big issue that it's pretty common in most families to have somebody in their family who suffers from dementia or knows someone who has had it. So tell us a little bit of a story about the topic today.
Well, dementia is a disease that affects so many people. And the thing about dementia is that while it is devastating for the families to see their loved ones in that condition, the actual patient, the client, is pretty much oblivious to what's going on. It really victimizes the family and the client, of course, but the family really goes through an emotional upheaval when their loved ones are diagnosed with dementia.
Yeah, definitely. So I'm going to ask you a few questions, and then you can, share with us your thoughts on dementia and your experience. Okay?
Absolutely.
So first question: what is the biggest difference between dementia and Alzheimer's?
All right. Well, dementia is an umbrella term for pretty much any diseases that have an effect on a patient's memory.
Okay.
Alzheimer's is a specific disease. So basically, anybody with Alzheimer's has dementia, but not all people who have dementia have Alzheimer's.
Okay, that's good to know, because they get confused a lot between the two different terms.
Absolutely.
So, what are the other forms of dementia?
So dementia can take a lot of different forms. One of them actually affects the blood vessels in the brain.
Oh, okay.
It really affects the blood supply to the brain, causing a progressive loss of memory. And so people with the vascular dementia have that. Then we have something called dementia with Lewy body syndrome. And a lot of those clients, they display Parkinson-like symptoms. So their gait is affected. They might have tremors, that type of thing. We also have something called young onset dementia. So that affects people actually before the age of 65. It appears, the symptoms appear. And then we have the early onset dementia, which you can get clients with dementia-like symptoms as early as 45 years of age, even younger than that.
Wow.
And it's rather progressive. It moves very, very quickly, and the outcome is not good.
No, it wouldn't be.
Yeah.
Some sobering thoughts about that. So I'm glad that there's people like you who can help them through that thing and help the family during that time. Next question I've got for you is, can you give us an idea of what symptoms of dementia are like? How do they present?
Well, there's a lot of different symptoms, and of course, unfortunately, a lot of those symptoms we experience in our everyday life. But with somebody with dementia, you're going to have something like memory loss that affects day-to-day abilities. And what that really means is it's normal to forget the odd thing, like we usually do. But with a person with dementia, they forget a lot more often. And it's really out of place. And it gets to the point where the family says, gee, that's odd, mom or dad, and they never used to be that forgetful.
Okay.
Things like that. Another thing is difficulty performing familiar tasks. So you might have a loved one who, say, was a carpenter. And, in their retirement years, they like to, play around with carpentry things to do. And unfortunately for that person, sometimes they forget how to do that. So then it's very noticeable, and the family thinks, oh my goodness, like he used to do that all the time and now he can't do it anymore. So those are some of the things that happens. Problems with language too. You'll have a simple conversation with somebody and then they just can't think of the words and it just doesn't come out. And sometimes they try and hide it because, a person with dementia, especially at the very beginning, they notice something's going on. So they will try and make it seem like it's not, not something that, it's just something they forgot. It's not something that happens to them quite often. Another thing is disorientation in time and space. Those are things like, your dad goes on an errand to the store, he's elderly, but he doesn't come home and you're wondering where he is. Well, he's lost. And he doesn't know where he is either. So he doesn't even seem to realize that he drove to wherever he was going. It's something that escapes their minds, and also time. So sometimes they think that they're in a different year or a different month or a different day. So those are very unsettling things.
Yeah, that would be.
Yeah.
So it's pretty serious, especially somebody who gets lost and doesn't know where they are.
Yep.
That would be kind of frightening for both people, for the person who's lost as well as the family. So that's quite something.
Yep. Another thing is impaired judgment. So someone, and the best way to explain this one is, going outside in minus 20-degree weather in a pair of shorts and a t-shirt. And they think that's perfectly fine. Until, of course, they're outside. Things like that. Another thing is abstract thinking. So use of a calculator or anything that they've used before, reading a recipe. And they just don't understand what that recipe is all about. And yet they've cooked that certain recipe many times before. Misplacing things. Finding things like an alarm clock in the freezer.
Okay.
Yeah.
All right.
Yeah. Things like that. Changes in moods or behaviors. So you might have someone who's normally a very calm, gentle spirit, and all of a sudden they're showing this anger or tendencies to be violent. Okay. Things like that. Changes in their personality. Again, look to what they used to be and what's happened, and it's a sudden change. It's not something that works its way to that point. It's something that happens quickly, and then the family's going, well, what's going on with him or her or whatever. And then loss of initiative, and you might think that might be depression, but that is another symptom of dementia, is you lose your initiative, you're just not interested in doing anything anymore. Yeah. So families often will say, what do we do at this point? And at that point, you need to take your loved one to a physician and have them be assessed. And they do have specialized tests for that, and they'll determine from there what's going on. And it could include a CT of the head, CAT scan. That will also help determine the diagnosis.
Okay. Wow. There's a lot of information, a lot of things that people may or may not know about dementia there.
Yeah, it's a disease that affects a lot of people, and it's devastating.
So Teresa, can you let us know, who should a person contact if they notice some of these symptoms?
I think the best thing to do at this point is to get a hold of the family doctor and get them in there as soon as possible and have them tested. And that could be different tests like a CAT scan they might want to do that. They also do other tests with the client, have them answer questions, draw things, and anybody with dementia will have some difficulty doing that, even as simply as drawing the face of a clock. You'll find that that is also very evident that dementia might be present.
Okay.
Yeah.
Now, where does Qualicare fit into this picture?
Well, we at Qualicare are very passionate about our clients, and anybody with dementia we are experienced with. And once you're aware of the diagnosis, just give us a call. And the family might come to the conclusion that this diagnosis of their loved one is a lot bigger and more work than they are able to do. You know, life happens. So we have solutions to meet any of those needs, and we provide companion care, housekeeping, any kind of medical care as well. We will come to your home, do that free consult, and determine from there what the care plan is for your loved one and your family, because we also take that into effect as well. So just give us a call and we'll be there to help you out.
That's excellent. I love that you guys are there to help.
Yep.
No matter what the situation is.
Yep.
So speaking more on that, what about medical needs? Does Qualicare get involved with that as well?
Yeah, we handle all the medical needs as well. We work with AHS, who has home care teams that are able to come out and help the client. But if they're not using the funding that is available to the client, we can be involved and provide that care for the client, whether that's you know, getting them ready with their ADLs in the morning and their activities of daily living, or getting them dressed, feeding them, providing them their medications, that type of thing.
Wow. So there's a lot of services that you provide for people with dementia, for their families. So how does somebody get a hold of you for that consultation?
Well, they just have to give us a call, and our number is 780-328-6655, and our webpage is www.qualicare.com/Edmonton-East, and have a look at that, and you can get a hold of us at any time. We're a 24/7 business, and we provide care 24/7. So we also provide respite care too for those caregivers out there who are caring for their loved one but that need a break, and we are there to help them with that.
Excellent. Well,
Yeah.
thank you so much. That was a lot of
you.
great information about dementia and how it affects people, and what you guys can do to help. I think that's the biggest takeaway from this discussion, is that there is help out there for people who are going through this with a loved one or going through this themselves. And I think that a lot of people here will be giving you a call and asking for some help, or they'll be referring you to someone that they know and love.
Oh, that'd be great.
Awesome. Well, we'll see you guys next time on the next video with Teresa.
See ya.